What are the barriers that young people with alcohol or substance use disorder face when seeking treatment?
Many services require people under 18 to bring an adult to appointments. And this can be a huge issue because a lot of young people don't necessarily want to disclose their substance use to their parents or other caregivers. And on top of that, very few services are actually designed for youth. So most programs are made for adults, and there is also often an age gap between staff and youth that might access the service that can create a certain discomfort and also discourage access. And on a wider systemic level, youth also faces practical barriers, for example, long waiting lists or lack of health insurance approval or an inability to pay for the cost of the care, a limited knowledge or access to knowledge of available services. And even language barriers can be an issue. These challenges can make treatment feel out of reach, also for those young people that want to access the services. Something else is that professionals often lack training on how to work meaningfully with young people. And there are very few guidelines for youth specific harm reduction or treatment. So, even where there is willingness, services aren't always fully equipped to reach young people. There are youth-led civil society organizations, and some that come to my mind are, for example, Youth Rise or the Youth Organization for Drug Action. They're stepping in to fill this gap, especially through research and advocacy. So these organizations are actually generating a body of evidence and highlighting youth experiences and pushing for policies that reflect the realities of young people. And finally, I also want to mention that before we even talk about treatment, it's important to recognize that curiosity about substances in youth is natural, and the substance use among young people can be a part of exploring identity, autonomy, or social connection. And this is also why accessible and youth friendly harm reduction education really matters. Because also, when young people are equipped to make informed choices, this is also why accessible, youth friendly harm reduction education matters. When young people have accurate and not judgmental information, they're also better equipped to make informed choices and to reduce potential harms, whatever their relationship to substance use may be.
What strategies could be implemented to overcome them?
Services really need to adopt a multi-layered and youth-centered approach. And that means involving youth meaningfully, like including them in design, decision-making, and also management of services. Another really important thing of involving youth in services is by hiring peers that have lived experience or that somehow have similar life experiences with the people that services are intervening in. That can be done, for example, by investing in current clients, creating a pathway for them to become staff, and helping them through the process of hiring them. Another thing that's really important is to ensure that services are youth specific, so that we need to understand that young people who use drugs have different habits, preferences, and even needs than older adults. Some of those needs are related to development, and they are in different stages of life. So services must reflect that. They must be designed based on those needs. To design youth-friendly spaces as well, based on their own ideas, the youth ideas of what feels safe and accessible. It's also important that services try to meet people where they are, and that means both in their communities and their drug use. For their communities, think of schools, drop-ins, youth centers, online platforms, street-based spaces, and even easy-to-access local services. And think of flexible hours, walk-ins, and be tolerant with lateness and missed appointments. Look into outreach models and on-site counseling. And just as importantly, meet people where they are in terms of their goals around substance use. Another very important thing was confidentiality. So confidentiality is critical. Young people need to know their privacy is protected to feel safe enough to ask for help. Create space and separate counseling spaces within your services and be clear about how confidentiality is handled. And lastly, engage families. train providers to reduce stigma and foster support. Family education about drug use can increase support and trust, and the most effective parental support involves high levels of contact, trust, and warmth. When young people feel seen, respected, and understood, we break down the barriers to care and open the door to recovery.
Can you tell us about successful examples of harm reduction initiatives being implemented in schools?
For decades, abstinence-based sort of approaches have dominated prevention, and I'm thinking of programs like DARE, the classic Just Say No campaign in the US. But research shows that these sort of programs don't actually reduce drug use, and in fact, they might actually do more harm than good. And they do this by leaving young people unprepared to make safer and informed choices. So if I think about a successful example of harm reduction in schools, I can mention the Safety First curriculum that was developed by the Drug Policy Alliance. And this program provides teens with honest and evidence-based information and teaches practical harm reduction strategies. So unlike abstinence-based programs, another type of program like Safety First recognizes that some young people do use substances and actually gives them tools to stay safer. So there has been pilot studies on this, and it has been shown that students who completed the program had more knowledge about harm reduction and also overdose response. This sort of program is interactive and is stigma-free and also more effective than traditional models. Other positive approaches highlight the use of what is called critical pedagogy. That is a method where students and teacher co-create knowledge together. And this boosts engagement and understanding. So the goal is clear. Harm reduction education must be inclusive, relevant, and engaging.
Regarding the legal and ethical challenges that hinder young people's access to harm reduction services, what key factors should policymakers take into account to develop more inclusive and effective policies?
So the two key challenges that policymakers should consider are legal restrictions and the lack of clear guidelines for youth services. In many places around Europe, harm reduction organizations are not allowed to serve people under 18, and this leaves young people using drugs with no support, no tools to reduce harm, and no access to clean equipment. Some youth even celebrate their 18th birthday by finally accessing clean paraphernalia. And that's how dire the situation can be in some countries. Besides, in some countries, services can't be provided without parental consent. That excludes young people who've lost family bonds and those who don't feel safe discussing drug use with their parents. Policymakers must remove these age-based restrictions and guarantee that young people's right to confidentiality and secrecy is there. And to develop better policies, young people must also be meaningfully involved. At every stage of the process, young people need to be there, from design to implementation to evaluation. Far too often, youth participation is tokenistic, but real participation strengthens both the policies and the communities they aim to serve. Let's also recognize the barriers youth advocates face, from hard to reach decision makers to stigma and generational gaps. They are there. And drug policy is political and often dismisses the voices of youth. Policy must prioritize health and human rights over criminalization. Instead of excluding young people from these conversations, we need to build policies that reflect their realities and protect their well-being.